Hey, I'm Luke Schellenberger. I'm an ENT doc. So what is this thing? This is our CT scanner. We have a CT scanner in our office that allows us to take CT scans, usually of patients' sinuses, occasionally of patients' ear bones or temporal bones. It's extremely helpful. Basically, you cannot operate, or you should not operate on the sinuses without a CT scan first, because it defines the anatomy, where you're going to work, what sinuses need to be worked on. When we see patients that have a growth or something called a polyp in the nose, we need a CT scanner to see where it comes from. And so we're using CT scans as a routine way of working up sinus disease. If somebody comes in and says, Doctor, I've had a sinus infection for months and months. I can't get rid of it. I've been on 3 or 4 or 5 or even more courses of antibiotics. Other than doing a good exam, looking in the nose with a scope, a CT scan is going to be one of our most important ways to evaluate those sinuses. And so if you're in the office and you say, hey, we need to get a CT scan, this is our scanner. And there's some technical differences between this type of scan, what's called a cone beam CT scan, and a regular CT scan that you're going to get at a radiology office or in the hospital. It is less radiation, so it is safer, but it's not for everything. If you've got a neck mass, we're not going to get this type of CT scan. This CT scan is specifically for sinuses and ear problems. But anyway, this is our CT scanner, and it's a really helpful part of what we do when we're evaluating sinus disease, and to a lesser degree, middle and inner ear problems. All right.